If you've got shoulder pain, it might be because of a fall or maybe some other traumatic event. For other people, though, it's degenerative, like shoulder arthritis.
In Omaha, there is a place fully dedicated to shoulder care. One of the doctors on the team is here to help us imagine better health.
Dr. Matthew Dilisio is a CHI Health Orthopedic Surgeon. Good to see you, Doctor.
Welcome back.
Thanks for stopping by. I've got this click. I got this click in my shoulder. Okay, we'll talk about that later. But your shoulder problems, that's your area of expertise. Mm-hmm. You've been all over the world studying shoulders, won numerous awards. What is it about the shoulder that kind of intrigues you?
For me, I like that while I mainly just do shoulder, you do everything from joint replacement to treating high school athletes with instability to fractures. I mean, you're kind of everything, and your expertise is just in that area. So that always intrigued me. Yeah.
And I want to let our viewers know how cool it is to have you practicing in Omaha. He's written chapters in books that other doctors are studying. Like, he's the guy who's teaching and training the next generation of surgeons. So I think that's to be commended, all the awards and everything. Not that you're going to be the guy that points all of that out, but I think it's worth saying.
Well, thank you.
Shoulder pain, I mean, anybody who's had it, they talk about being miserable. How do you know if it's just something that's going to work itself out, or when is it time to seek care?
Yeah, well, you're exactly right. The shoulder is very important and can be exquisitely painful because there's so many nerves in that area that make it so sensitive. And usually what we say is when somebody has a chronic problem that's been going on for months to years, it's okay to sit on that for a little bit, and that's the majority of what we do, is try to get people better with the safe, effective, conservative things like therapy and injections. If something is traumatic, though, based on what it is, if it just doesn't seem right, if the pain is not going away after a day or two, usually that's when it gets checked out, and whether that's with the primary care doctor, your family doctor, or seeing an orthopedic surgeon, we normally just differentiate to see if it's the thing that just goes away. And then actually, the thing that I commonly see, especially in guys, is they put up with a heck of a lot until they start losing sleep, and then they're in to see us really the next day because they won't tolerate that.
Yeah, worst case scenario though, and I guess the last resort is shoulder replacement surgery. And you hear about knee replacements, you hear about hip replacements. I guess I didn't realize they were as common as that, but describe that process of the shoulder replacement.
Yeah, well, it's very common. We certainly do a lot more knees than hips, but shoulder arthritis is very real, very common, and then the treatments that we have for that are excellent. So essentially when we're replacing the shoulder, what happens is the cartilage wears out, so it's bone rubbing on bone. And then I have a shoulder model right here to demonstrate exactly what we do. So here is the shoulder blade, or the scapula. So what we'll do is we'll replace the socket with a little piece of plastic right there, and then this is the humerus. It's a little tube of bone that we're able to slide this in, and then we replace the ball and socket with a new metal ball and then a plastic socket. And then the shoulder rotates like that.
Oh, wow.
So what you said, where the cartilage would have been, now you're creating, but the shoulder can function just the way it would have for years prior.
It functions very, very well. And what makes it function very well is the rotator cuff then hugs the top of the shoulder like the covering on a baseball, and it allows it to stay in the joint. The issue is what happens if the rotator cuff tears with shoulder arthritis or a shoulder replacement in, and then the shoulder, when it moves, it starts coming up, and then it'll fail, so we have to come up with another solution.
So what you're talking about there, is that a total shoulder replacement, or how would you characterize that?
This is a total shoulder replacement done through a small incision in the front of the shoulder. What we've developed in the US and Europe over the past 15 to 20 years now is actually the reverse shoulder replacement, which has revolutionized the way we can treat complex shoulder problems.
And what is
What's
it?
that? Yeah.
So the reverse shoulder replacement, same incision, similar recovery, but we actually switch some of the parts around, and it looks something like this. So instead of doing a plastic socket, we actually put the metal ball on the socket side like this, and then instead of placing the ball on the humeral side, we actually put the socket right here. So essentially we're just changing the parts up. And that's important because if somebody does not have a rotator cuff, instead of dislocating the shoulder, the ball stays in the joint and moves around. And now this traditionally was used for patients with arthritis and a rotator cuff tear that can't be fixed. And now we're using it for all those people in addition to fractures, revisions, all sorts of things, and the results have been absolutely tremendous. So
what's the recovery for the shoulder replacement, or I guess the reverse? Are they similar?
They're relatively similar. Usually it's sling for about a month, and usually that's the big bummer, is people getting around with one arm, but they're able to eat, drink, hold a book, do things like that in a sling. And then after that, we kind of cut them loose. We take it easy in terms of heavy lifting and things like that. But beyond that, the recovery is relatively quick.
And then the procedure itself, how long does it take once you're admitted? Then what?
So for this, we're moving towards sending people home the same day, although that takes a very specific type of patient. The majority of these people come in overnight and we send them home the next morning, and they're pretty comfortable.
That is awesome.
Right. But your team, you really focus on the diagnosis and the treatment is what you do. Is that pretty unique in the area?
Yeah, it's nice to be part of a big system like this at CHI, because not only do me and my partners focus as shoulder surgeons, but we have a whole team of therapists, nurse navigators, everything, whether it's a little bump on the shoulder that we can rehab to, you know, big revision shoulder replacement. The whole team of us kind of put our heads together to get our patients heading in the right direction
that one
from
stop.
point A to point B.
Yeah.
And that's really what it is. And not only in orthopedics or shoulder surgery, but all throughout healthcare, the coordinated systems are the way that we're really pushing the limits to make our patients do better sooner.
Well, you see the outcomes improve with those patients when there's this coordinated effort around them. It's choreographed, and it's less stressful for the patients. I mean, I think they probably heal up better. You see all these things. Even the cost and the time, that stuff comes down, resources, it's tremendous. And we want you to learn about your options if you've been dealing with shoulder pain, or maybe it's like your husband is there, as Dr. Dilisio is talking about. You can call and they'll send you information packets with details. The number is 402-717-0820.
Yeah, so about that click in my shoulder, doctor. We'll get to that in the commercial break.
We can take care of that.
I can't wait.
Thanks for coming. Great.
Thank you so much.
Thank
Thanks
you.
for having me again.
Happy Thanksgiving.
Yeah, happy Thanksgiving to you.
Thank you so much. Well, next.